I'm Dr. Swati Naik and you are watching us live on MCure AICOG TV from Bhubaneswar on therightdoctor.com. I'm pleased to have with me the very favorite teacher of mine and a very pleasant personality from the field of obstetrics and gynecology, Dr. Ashwini Bhalerao Gandhi. She is a senior consultant at Hinduja Hospital in Mumbai. She has been a vice president of FOXY in 2013, president MOX in 2012 and 13. Apart from being a very good clinician, teacher, she has also actively been involved into a lot of social activities for women's health care, and she is a very good writer. She has a lot of books to her credit. Thanks ma'am for joining us on MCure AICOG TV. I think we are going to have a wonderful conversation with you on a various aspect of women health and as well as one of the topic, that is hepatitis in pregnancy, where you have talk in AICOG 2018. So ma'am, welcome to the studio.
Swati, thanks for calling me here. And at the outset, I would like to present this book to you. It is entitled Stritva Ani Arogya. It is in Marathi. That means feminine problems
Thank you so much. Thanks a lot.
related to health. And this is the second edition which is there now available for women.
Okay.
And maybe I'm sure even the gynecologists can keep this book in their waiting room, so whoever patients are coming and waiting for them, they can just go through this book and have some information through it.
Okay, ma'am. I mean, just to mention, what are the different topics, broad topics, you could just enlist, what are the important topics that you have captured in this book?
There are various topics which I have covered. We can say from puberty to menopause and beyond.
Oh, nice. So I think, and that too in the Marathi, if it has been published, it would be definitely useful for the Maharashtra population. But I am sure that you must be looking at getting it published in a various different languages as
Yes,
well.
yes, definitely.
So-
English and Hindi also.
Okay,
I am
nice.
thinking about translating and publishing in these languages.
Thanks. Thank you. We are looking forward for those editions, ma'am.
Thank
you
you.
so much. So coming to your topic in this AICOG 2018, you talked about hepatitis in pregnancy. Something very different topic apart from what we say that it will come under the medical disorders of the pregnancy or infections during pregnancy. And what are those elements related to the liver during pregnancy?
Before we start the topic, Swati, let me tell you that when we ask the question to anybody, how is life? And the answer given is it depends on the liver. So liver means the person, and also liver means inside your tummy, you're the liver. It is very, very important for our life. And especially during pregnancy, a lot of problems can take place which can affect the liver. So the whole spectrum of hepatitis in pregnancy was covered by me in the lecture. And here I would definitely like to mention efforts taken by my ex-student Dr. Vrushali Kamble. She and me, we prepared this topic together and we have written an article also in the FOXY Focus on the same. So when we talk about the spectrum of hepatitis, we can go from first trimester, second trimester, third trimester. And in first trimester, we can start with hyperemesis gravidae. Because of excessive vomiting, sometimes the liver can get affected.
Oh, really?
The hepatic function can derange. And then we need to look after the woman by admission, giving her hydration, giving her rest, etc. Then the next thing which can happen is in second and third trimester, pre-eclampsia. That when the hypertensive disorder sets in, liver can badly get affected and she also can go into the HELP syndrome, which can lead to even morbidity, mortality of mother as well as the baby. And then we can also talk about the acute fatty necrosis which can happen in third trimester of pregnancy, and that can lead to lethal complications. And viral infections also, they play a very major role in women, especially when they are pregnant, and they can be life-threatening. So when we talk about the viral infections, we have to talk about ABCDEF. So that out of that, hepatitis A and hepatitis E are through orophycal route. Means if one is not looking after one's health hygiene properly, not washing hands, and the food and is contaminated with feces of the person who is already affected by these viruses, then that person can get affected. And
Sanitation comes of a very important role.
when we talk about Swachh Bharat, I think this is very important fact of our Swachh Bharat, and we need to tell this to women.
Right.
That hygiene is very important to prevent, because prevention is better than cure.
Absolutely.
And this is especially so as far as hepatitis is concerned. So we need to tell them about that. Usually any pregnant woman, she can come with malaise, fever, then vomiting, nausea, then pain sometimes in abdomen. The stools can become grey color, and the eyes then become yellow. And then such woman, when she comes to the obstetrician and she says that I'm pregnant and these problems are there, then definitely we need to do lot of investigations. We have to come to some diagnosis, and multidisciplinary approach becomes very, very important, because only a obstetrician may not be able to treat the woman properly, and we need to take opinion about our physician, gastroenterologist, and now hepatologist.
Oh, right.
So now we are in the super specialty era,
Right.
and even the hepatologist's role becomes very important to prevent maternal morbidity and mortality.
Absolutely. So yeah, ma'am, if I have to conclude that hepatitis per se, if anybody is having perception that it's just going to be a infective origin, it is not so. You have enlisted very important topics like hyperemesis gravidarum,
Yes, yes.
which by and large is considered as a normal phenomena. But one need to also think that if it is a excessive, then one need to check liver enzymes, and if there is any affection to the liver. Second is a preeclampsia with the raised liver enzymes and the fatty necrosis of the liver. Apart from having our infective etiology of various viral infections coming into picture. Ma'am, is there any role of immunoprophylaxis for such cases?
Immunoprophylaxis for hepatitis A, pre-exposure vaccine can be given because it is inactivated vaccine. But in fact, I would tell that not only pregnant women, all of us, you and me,
Mm-hmm.
need to take vaccination
Oh.
for hepatitis A, hepatitis B,
Mm-hmm.
and now other vaccines may come up, but at least this A and B are very, very important. And especially if we are eating out, we are all out here, and I think we should take vaccination, including typhoid vaccination. It's very
Oh.
important not only for the women, pregnant patients, but even for doctors who are treating them.
Oh.
Because if we are healthy, we can keep our patients
Patients
healthy.
healthy, right.
I just wanted to tell you a few things about hepatitis B and hepatitis C. So their transmission is not through fecal-oral route, that is through infected blood products, or IV needles, etc., IV drug use, and that's why sometimes they are associated with HIV infection because the roots are same.
Right.
So when we come across these patients of hepatitis B, there is a very high chance that the in utero transmission can take place, which usually doesn't happen in hepatitis A, because the immunoglobulins from the mother, antibodies, will go to the baby through the placenta and the breast milk.
Right.
But in hepatitis B, the baby can get affected in utero and afterwards also. And that's why as soon as the patient delivers, the baby needs to be given immunoglobulin
Okay.
and active vaccination as well, 4 doses.
Right.
So again, the role of pediatrician, neonatologist is very important, and the baby otherwise can become hepatitis B carrier, which in long term can lead to hepatocellular carcinoma and cirrhosis.
Oh my God.
So we have to see about the long term consequences not only to the mother but also to the fetus and the baby. So hepatitis B in that way is very important.
Very important.
But that doesn't mean that we have to deliver the patient by cesarean. Only if the mother is having hepatitis B or C with HIV, then we can consider of delivering the mother by cesarean. Otherwise, a regular delivery should be undertaken. But only thing, lot of interventions we should avoid, like fetal electrode to be applied to the scalp of the baby, etc. should be avoided. Premature rupture of the membrane should be avoided. But cesarean is not mandatory for all women who are having this hepatitis, except when you feel that if you terminate the pregnancy, the mother and baby will come out of this hepatic crisis. Then only we can think about terminating the pregnancy, especially with acute fetal, acute liver necrosis, etc. We may have to terminate the pregnancy, and then only the mother and baby can be saved.
Absolutely. So I think we can come to a message that the prevention is more important in such cases. We need to protect ourselves as well. So if we are protected, we can protect our patients. The way I think I remember early morning, Brahma Kumari, Miss Shivani, she gave a very good message. If we are happy, we'll make our patients happy. If the mother is happy, the baby will be happy. So the message is very clear: protect ourselves as well as protect our patients for such cases. And the prevention, which is, I mean, the simple measures like sanitary measures, hygiene, which are in our hand. If we take care of those, we don't have to face those serious problems of such infections or inflammations of liver during the pregnancy and in the postnatal care. Thank you so much.
Just
for
one
joining. Yes.
sentence I would like to say, Swati, sorry to interrupt you, that hepatitis E is the worst type of virus
Oh, really?
out of all the viruses. And most of the mortality of the mother and the baby happens because of the hepatitis C. And this hepatitis C, at present vaccination is not there and recommended. But again, the sanitation and hygiene and hand washing and proper taking care of the food and water is most important. So simple measures. We don't need expensive medicines. The
Right.
simple measures are most important for good health of the mother as well as the baby, and ultimately then even the doctor's health becomes better, because if we are all the time facing the complications, then our health is also going to deteriorate.
Absolutely. So a multidisciplinary approach we can look at is along with the prevention and the protection of the patient. Thank you very much, ma'am, for joining us on MQR AICOG TV. Thank you.
Thank you. Thank you.